I'm Bethany Russell Lowe. I'm the settled minister at the Unitarian Universalist Church of Tucson. And I'm here just to provide some space for us to calm ourselves and to think really intentionally about how we are going to stay connected with one another throughout this COVID-19 pandemic.
How have you been feeling these last few days?
I have been feeling anxious and worried for myself and my family, my friends, and my congregation. I've been feeling alone in some moments and also connected in other moments. I know how you're feeling right now because I'm feeling a lot of it too. We collectively and individually are feeling isolated, fearful, scared, like we're living in a surreal world. Some of us are feeling calm still. Some of us are feeling that there's opportunity in this moment. They're feeling some excitement about that. But a lot of us and too many of us are feeling alone and isolated and scared. And I want to honor all of that in you because whatever you are feeling is real.
How is that different for you being a minister versus being somebody else?
Oh, as a minister, my whole world is turned upside down. I mean, we are not a Christian tradition right now, but for 2,000 years, people have met in houses and they've met in congregations and they've met in temples and mosques and other places of worship. And we are not meeting in those places anymore. We are meeting online. We are meeting over email. We are calling one another, FaceTiming one another, Facebook messaging one another. Some people are writing letters, and it feels like the whole world of church is turned upside down. We are meeting in different ways. We are being forced to meet one another in different ways.
This is a big challenge for you at this church and for all churches because people are feeling so helpless and so vulnerable.
Mm-hmm.
What are you hearing from your congregation now?
I'm hearing from the congregation that they are feeling isolated, that they are feeling that their schedules have been totally disrupted by the cancellations and the postponements, and like there's a new normal that doesn't quite feel normal yet. I'm also hearing some denial that any of this is really as serious as many people are encouraging us to take it, and I think that's important to honor too, that one of the places we go in grief, and I believe all of us are grieving right now, because we are grieving losses of activities, of communities, of regular schedules, of our friends who we're not seeing or who are not willing to come see us personally. We have to remember that a stage of grief is denial, is denying that this is happening, and to meet people when they're there, and to offer them space to be there, and to work through that stage of grief, because we've all been there before, whether we're there now or we're not.
In some ways, the whole community is in this stage of grief that you've described. Hospitals, the blood supply, nonprofits, businesses. How do you think about that in this time when the whole community is in a sense in shock?
Mm-hmm. I think that we need to honor that shock as a very real thing. We can't shame people for feeling that way because everything is being turned upside down. It's topsy-turvy, it's surreal, it's so different. And then also to acknowledge that shock on ourselves and move past it towards community, towards connection in new and different ways. I'm thinking so often, and I'm holding in my prayers daily, medical professionals who are on the front lines of this and who will continue showing up to work more than they ever have to help us fight this disease and to help us get the information we need out and transparently into the public so that we can prepare ourselves.
At this time, we're asking residents of Tucson and around Pima County not to come in to visit patients and family. We are limiting visitation to parents of one child, that will be the patient relatives, one relative for someone who is in critical care, if they're in a crisis situation and we're not expecting them to survive, or if you're coming for delivery of a baby.
People have begun sewing the face masks for people in the hospitals because hospitals in different states are asking for them. So can we reach out to Tucson area hospitals or hospitals wherever we are to say, what do you need? What can we do from our socially and physically distant place to support one another? And remember that we're all still here, that we're still here. Many of us are able to do things. We just need to learn different ways of connecting and supporting one another.
What are your hopes going forward during this time of challenge? What do you hope? How do you hope that we rise to the occasion, if you will?
I hope that we do take that challenge to find ways to connect and prove to ourselves that community is still there. And prove to one another that we are still there to support one another, that even though we cannot be physically proximate, that we can be emotionally proximate, that we can call one another more often. I'm actually hoping that this is the time when we realize how strong community can be and where the weak points are and where we need to strengthen our bonds with one another. There's a huge opportunity in this time for the veil is being pulled back from the places where our community, the strands of our community are too weak. And we have an opportunity right now to strengthen those strands through whatever means possible.
Is that part of your ministry plan in this time of challenge?
Yeah.
Or what is your ministry plan?
Here at the Unitarian Universalist Church of Tucson, one exciting thing that we're doing is these circles of care. So we're opening up zip code-based, neighborhood-based circles of people. There are 7 to sometimes 15 households who agree to stay connected with one another, to call one another, to FaceTime, to use Zoom, and other means to connect with one another regularly and check in, say, how are you doing? What do you need? And then if that cluster, if that circle of care can fill those needs for each other, to do that. So do you need grocery runs? Do you need your meds picked up? Do you need for me to not talk about COVID-19 for an hour? Do you need someone to send you a good book that's been sanitized beforehand, right? To read during this time, to be really honest about what our surface level needs are, and then to start getting honest about what our spiritual needs are, and to offer one another those resources too. And I, as the minister here and our director of religious education, Jamili, and all the other staff really are looking towards providing those spiritual resources to those circles too. I heard from my college roommate a few days ago who she and I have not been in good practice of talking recently. And she said, you want to chat? And I said, yeah, of course. My cousins started a group chat recently, and we said, maybe we should all Zoom or FaceTime together or talk in video together. So even in those moments when I'm feeling isolated, and maybe the moments when I feel most isolated, there's always a text from somebody or an email from somebody or some communication from somebody that pulls me back into community and reminds me that people are there even though they're not here, and that we can be here for one another in new and different ways. So I want to encourage anybody to keep showing up to worship, however that's happening in your context. If you're a member of the Unitarian Universalist Church of Tucson, we're having worship on Sunday like usual. It's exciting time, actually. The Baja Four, the 4 congregations in southern Arizona, will be doing worship collaboratively. All the 4 ministers of the parish of the different congregations are coming together and recording a worship service and posting it online to all our Facebooks and YouTubes and websites, anywhere we can get it. And we're inviting you to join us for that worship experience so that we can remember that we are resilient, that we are coming towards community in this time, not away, that we are proving that we can do collaborative, innovative, online worship across our southern Arizona congregations. And we are focusing in particularly on themes of resilience and thriving, and turning to our natural environment, the desert, to remind us of how resilient we can be. So often the poetry I read about the desert talks about the barrenness and the time of despair and the 40 days of walking through, but I look around the desert and I say, that thing is alive, and that's a miracle. And so we're going to look to our natural resources around us, the natural landscape, to remind us of the resilience that is inside each of us and inside our communities that can help us thrive in this time. So do watch worship at your usual time, 10:30, here at the Unitarian Universalist Church of Tucson, or because it's recorded, you can watch anytime. If you're looking for that live worship experience, I will be on the UU Church of Tucson's Facebook page at 10:30 on Sunday mornings and having a watch party for that worship experience, so we can chat in real time and comment. You can have a little taste of liveness, even though it's a recorded thing. And then afterwards, we are having a Zoom social hour, which we started on March 15th, and we heard great feedback on. So get downloaded to Zoom, find that link. We'll probably put it in the comments of this video, and join us for social hour, no matter where you're coming from. It's from 11:30 to about 12:15 this week. So we are going to worship through that recorded environment and in the watch parties on Facebook for a while now. We don't know how long a while means. We don't know how many weeks. The CDC has advised that groups of 50 not gather for at least 7 more weeks, but we all know that it could be a little longer. But we are going to keep gathering in all the spaces. We are going to continue to support one another, to ask one another, what do you need? And to say, oh, I can do that, or let me help find someone who can fill that need for you, because this is a time of resilience, of looking at resilience within ourselves, within our communities, and with our larger context here in Southern Arizona and the world. This is a time to lift up the beauties of community, how in times of disaster, we actually can move towards one another and not away. So another critical need we know about now in our community is the need for blood. All of these community and company and other blood drives in the area have totally halted, have totally stopped right now. So there is a need. The Red Cross is asking for anybody who is able to get to a blood donation center to go there and to give blood if you're able and if they will accept your blood, to support those who need it in this time. That's a critical need that anybody who is able to give blood should in this time. My greatest hope in this time is that we will learn how to care for one another better. Throughout all of this, we are going to care for ourselves better. We are going to care for our families better. We are going to care for our congregations and our communities and all of the people who surround us in more innovative and just better ways. That's my greatest hope for all of us in this time, and I think we can do it together. If you are feeling isolated or alone in this time, or if you get sick in this time and are feeling worried because you can't get tested, or you are getting tested and you found out that you had COVID-19, please reach out to me or your care team at careteam@uuctucson.org, or just reach out to me any way you can. I want to support you, whether you're sick or feeling isolated, or you just don't know what to do. I'd be happy to make a call with you to a suicide hotline or to help you find other mental health support in this time. I know that you are not alone in your isolation. I know that you are never alone because you have us around you. You have me, and you have a lot of people that care about you. And if you need that reminder, please give me a call.